open. Hello, my name is Ethan Bolorowski. I'll be your student nurse for today. Can you give me your full name and date of birth? Okay, it's Jane Joe and it's May 1st, 2002. Let me check your wristband. Okay, it matches what you've stated. Let me provide some privacy, provide hand hygiene as well, and then we'll begin. So the doctor's ordered to put in an Indwelling catheter, and this is done because you have urinary retention. Is that okay? Okay, perfect. Do you have any allergies to betadine, tape, or latex? Anything like that? Okay, perfect. Also let me provide adequate lighting and provide good temperature to the room so you're comfortable. Are you comfortable? Okay, perfect. Let me also get you a blanket or sheet to give you some dignity and also some warmth during the procedure, because I'm going to have to expose some of you, but I'll be able to cover other areas as well. Also need to assess for pericare, so let me do that. Okay, provide clean area. Okay, pericare done. And since you are a female, I'm going to have to put you in a dorsal recumbent position, so I'm going to have your knees up on your sides, okay, on your left or right side. Okay, and then we can begin, if that's okay. Okay, we'll start with getting away from me. Staying within the 1 inch unsterile border while moving it. Okay. The gloves over here. Down mat. Also staying in the 1 inch border. Okay. Move that. Okay. Don't need this. Okay. So next I'll do gloves. Okay. Keeping sterile field with gloves as well. Also staying in that 1 inch border, not crossing over. Okay. Starting with my left hand and on the outside. Okay, it's not perfect, but we can still put the other glove on. Keeping my thumb out of the way to help with my other hand. Okay. I can now use the glove to fix my other parts of the glove. And since it's sterile, I can go on the outside and move it around so it's adequate. Having a little trouble, but it's okay. Okay. Okay, perfect. Next day in sterile field, keep my hands above my waist. Begin to set up. Take my alcohol swabs, put them in here. My syringe, attaching it. Attached, and there will be a cover for this, but there's not. But normally I would take the cover off, keeping it turned, take it off, throw it. And also the lubricant, we break that open, put that in the corner. Okay. And now we begin. So I move over, keeping it in the sterile area. I will first start with pinching your labia and opening it, keeping it open. And I'll do that with my not dominant hand. Okay. So keeping that open. And this hand is not sterile anymore. I'll do first further away from me, out of the way, and closer to me. Throw that, and then down the middle. Okay. Still keeping that there, I would then dip Dip the tip in the corner with the lubricant, and then insert. Okay. I see a splash of urine, and for the female, I'll go 1 to 2 more inches. If it was a male, I would go 2 to 4 or 3 to 4 more inches, excuse me. Okay. And also, you're going to feel a little pressure as well. Okay. Next, I will hold on to that and then do 10 cc's. Okay, that's 10 cc's, and then take it off. Tug it a little for securement. And also please relax the whole time. Then as it's in, I would remove the dirty gloves, wash hands. So I'm going to do that right now. Okay, then don clean gloves. So I have clean gloves on right now. Then I would secure the catheter to the patient's thigh. Okay. Giving enough room, and then also attaching it under the bed, on the bed rail, not on the side rail or anything. And then it's also not touching the ground. Okay. Okay, that seems to be all. We will come back and remove the catheter shortly. Okay. Okay. Then, okay. And give me your full name and date of birth. Jane Joe, okay. May 1st, 2002, perfect. Let me also check the wristband for your name and date of birth, okay. Okay, it seems to match what you've stated. So now I'm going to take out the indwelling catheter. So first I will empty the bag and remove the urine. Also take the tape off your leg, as well as once again do 10 cc's, but take out 10 cc's. Okay, let me do that. Okay. Okay, and then spin and pull. Okay, it is out. I'm also going to inspect the tip. There's not anything on the end, no pus or anything or any damage. So that should be everything.